Hello everyone, I am Dr. C P Ravi Kumar. I am a consultant pediatric neurologist based at Aster CMI Hospital in Bangalore. November 17th is celebrated as a National Epilepsy Day around India, mainly to raise awareness and to educate the general public about epilepsy. Yes, it's not just about the patients, it's also about the general public to understand what epilepsy means. The reason is epilepsy is surrounded by a lot of myths, a lot of misconceptions, and a lot of folk tales around it, mainly because this is always a kind of scary scenario when somebody has a seizure, especially for somebody to witness it. Children especially are not spared. Epilepsy can happen in children, and it doesn't always mean there is some shaking or somebody has to fall down or somebody has to pass urine when they have these episodes. Commonly people go and give metal keys and try to stop it. It is a myth that you can stop the seizure by giving a metal instrument. So many a times people try to do this and they think it has solved. Generally out of 100, 95% of the seizures stop by themselves within 1 to 5 minutes. So we assume that metal has taken away the seizures. It is not the case. Epilepsy or seizure starts from the brain due to too much of electrical activity or excess of electrical activity. The reasons are many. Sometimes it can happen without any obvious cause, but sometimes it can be because of a scar in the brain, which could have happened because of an accident, because of a stroke, or because of a birth injury. And there are some genetic conditions where the MRI or the brain scan is completely normal, meaning the structure of the brain is normal, still the individual can have seizures. So by giving a metal piece or anything, you cannot stop it. The other common myth is you cannot stop it or you cannot treat it. No, it is not true. With medicines, this condition can be treated. In addition to medicine, there are many other alternative therapies, for example, diet, even surgery, which can solve this. So it is very important to get a proper diagnosis and proper treatment or the right treatment for that particular child. The third myth is that this can happen during the full moon or the new moon, means Amavasya or Purnami. It is not true. This has been studied in detail at NIMANS. They have looked at all the patients. And when you have 30 days, you have one new moon and one full moon. Invariably, somebody or the other can have seizure on that day, and there is a kind of conception. Obviously, we don't have any clinical evidence or scientific evidence to back it up, but it is once again a myth. Another myth is about trying to pull the tongue out or trying to give something in the teeth, between the teeth, so that they don't bite the tongue. It is very rare for somebody with epilepsy or somebody during seizure to bite their tongue. But in the process of avoiding so-called injury, people try to pull the tongue, give their finger, try to keep a metal piece between the teeth and cause more harm. That is more likely than an individual biting their tongue during seizures. So these are some of the common myths. The other thing in the bigger picture, thinking it is contagious. Contagious means spreading from one person to another. No, it doesn't. It is like hypertension or a cardiac disease or heart attack. Just because your friend had a heart attack doesn't mean you will have it. And just because your friend has hypertension doesn't mean you will have it. Just because you go out for a drink or you go out for a restaurant with him. It is not contagious. So it is very important to understand. Many a times the society does more harm to the child or an individual with epilepsy than the disease itself. So these are some of the common stigmas and fears which general public should become aware and also avoid doing this to other families, because it can affect you or anyone in your family. So hopefully this Epilepsy Awareness Day, this video will help you to understand some of the myths. And I hope this video is useful and helps you to help those individuals who have epilepsy and let them have a better quality of life. Thank you.